my epiglottis. Give me that model right there because I'm going to be kind of referring to this as we go through it. Yeah, I'll put it right there. Put it down here. On an exam, if I put a piece of tape pointing right there, what would you think I would want?
External.
Nose.
The nostril.
External nares. Yep. Now, what if I put the pointer in there, or a piece of tape in there? Not there yet.
Nasal.
That is called the nasal vestibule. One of our body's vestibules is the nasal one. And what grows out of the nasal vestibule?
Hair.
Yeah, hair. And the older you get, the more grows. I guess you need more protection the older you get or something, but anyway. Hormonal changes, stuff like that, starts to grow faster. Once you pass from there into this area, you're in the nasal cavity, or as they call it, the nasal cavity proper. And the shiny stuff you see there would be the pseudostratified epithelium covering everything. Be a lot of blood vessels in there, but the bony structures in this right half here, in life you'd have a nasal septum right there, of course, but the bony things are conchae, C-O-N-C-H-A-E. I don't know if the book points it out, but some texts will call them turbinates. Turbinates, I guess, because they look like a turbine or something, but they're little shelves of bone. In between them are air passageways, and those are called, there's a concha there. That would be a meatus right there, where the air passes through. And they kind of break the airflow up, expose a lot more of the air to the surface of to the epithelium of the nose to help warm it and humidify it and so on. What would be, sorry we left you out, honey. This is your bag that I just stepped on and smashed.
Yeah,
I'm
it's
so
okay,
sorry.
I give him permission to move it.
Only a few things cracked in there. But anyway, up in the roof of the nose, it would have to be right here because that's where the nerves go through. Right in there is your smell epithelium, your olfactory receptors would be in there. So air comes in here. It's heading back toward the throat, of course, and being warmed and humidified and all that, but some's going to come up here and you can smell some of the molecules that are in that air, of course. Now, when the air passes out of the nasal cavity, it passes through what is called the internal nares. Now, there'd be two of them if we had a septum here, wouldn't there? Because you got two nostrils, two external nares, and you have the internals too. The internal nares, I would suspect, would be right about where I got my pen, right there. Not a structure, it's an opening. So when the air goes from here to here, here to here, it's in the throat. More technically, the pharynx. Now, let me ask you this. From here to about here, right in there is a part of the pharynx. Which part?
Nasal.
Nasopharynx, exactly. So if on an exam, you either see a piece of tape pointing in there asking what part of the pharynx is this? Nasopharynx. Sometimes you'll see a piece of tape spanning the entire thing and asking what part that is. Read the question carefully. If I put a pointer here, I don't want it auditory tube or adenoid or something like that. I would want the part of the pharynx, and that would be the nasopharynx. If I put a piece of tape on this structure, that would be the adenoid or pharyngeal tonsil that I want right there. Notice the crypt. See it right there? There are a lot of them in there, of course, but when air comes in here, the little bacteria come flying back through here, they get caught in those crypts, and then they are destroyed by your immune system. Right there at the end of my pen is an opening called the auditory, aka eustachian tube. Where does it go? What is it going to? Middle ear, right? You come on down. While we're doing this right here, if I can hold on to this pen, while we're doing this here, we got a bony separation between the oral cavity and the nasal cavity. bony what?
Power.
Hard palate. Bony or hard palate, okay. Back here is the soft part. Muscular, yes, but soft palate. What is the tip or the little point that hangs down on the back of your throat, which is the tip of that palate, the soft palate? Uvula. U-V-U-L-A. As I said before, when you swallow, one of the things that happens is a soft palate goes back against your throat and blocks the passage of food into the nasopharynx, directs it down this way. If you think about it, when you swallow and kind of concentrate, you can feel that happening in your throat. You can feel it pressing back against the back of your throat. Yes, ma'am?
You have like those weird kids can like put spaghetti through their nose and their mouth and go like this.
Uh-huh.
How can they do that if that blocks